My name is Yukai. I'm a professor here in the Cancer Immunology and Immunotherapy program at the Georgia Cancer Center. The mission of this program is to study how the body immune system interacts with the cancer cells, how we can utilize this body immune system to help patients to fight cancers. The inspiration why my lab keep doing on the liver cancer has came from three aspects. First, liver cancer incidence rate in the US has dramatically increased and nearly doubled in the last decade. And more and more American families have been impacted by liver cancer. I remember I have one colleague died of liver cancer in a few weeks of diagnosis. Secondly, in the world, this is the sixth most common cancer and the third leading cause of cancer death. And this is no effective way to treat this cancer. We are trying to engineering the human T cell, patient T cell, to fight for cancer. As you might have heard, immunotherapy has become the first pillar of the cancer treatment in the last few years. However, cancer immunotherapy depends on the T cell, which in most cases, especially in the solid tumor case, they do not have sufficiently enough good T cells in the body. So the research in my lab trying to identify the specific receptors to engineer the T cell so that the T cell can recognize specific tumor cells. So we started from T cell receptors that's naturally happen in our body, but it's rarely explored. So we developed that, and that one has been moved to clinical trial to treat patients now. The second project, which is currently in this work, is we created engineer so-called chimeric antigen receptors. Basically combine part of the antibody which offer the specificity and part of this so-called T cell signaling domain to activate T cell. So when you have this chimera on the T cell, you not only recognize specific tumor cell, but at the same time get activated so the T cell be mobilized to expand to fight for the patient. CAR T therapy since solid tumor has been so far not successful. The one of the reasons I just mentioned is they lose their function when you get to the tumor. But for us, novel CAR T in our development is that they can maintain their function in the solid tumor. They persisting there, they expanding there, they persist, they have function. So they basically say, okay, I'm here to stay, I'm here to fight, I'm not going to lose my function. So they have a great potential that the high-affinity CAR T to survive that hostile environment, to have the rule really going to have some generate anti-tumor effect, even going to clinic. So the next step is to move this project from our bench down in the lab to move to the clinic. So hope Dr. Koda and I can persuade the FDA give our approval so that we can start a clinical trial even in our cancer center. And during this process, we very fortunate to have 2 squad students working with us, and then to really they got trained for being working in the tumor immunotherapy environment so that they can have their own career in the future.